Did you know that cesarean section delivery in the world started in Tanzania? Midwives from Tanganyika, now Tanzania, in Lake Victoria specialized in giving birth by surgery about 100 years before modern science discovered that it is possible to give birth by surgery. When the pregnant woman fails to give birth in a normal way, the midwives use the traditional surgery that for many years they have been able to give birth without problems. First, they made natural wine using bananas and used it as an anesthetic during surgery so that the pregnancy would not feel pain. A very sharp knife was used to scrape the lower part of the navel, but the knife was heated on medium heat to kill germs that could cause problems in the surgical wound. This expertise helped a lot to make many pregnant women give birth safely without problems. After the baby was born, special traditional medicines were used to clean the wound and the whole area, and then sew up the wound very skillfully without harming the parent. Historians explain that it was very rare for pregnant women to lose a lot of blood or get any infection, except the problem that was reported frequently is the delayed milk from the pregnant woman. In Uganda, this traditional midwifery was done by men, but in Tanzania and DRC, this work was done mostly by women. When the Europeans arrived at the beginning of the 1800s, they were very surprised by this act and questioned how it was done. Midwives from Tanganyika and Uganda said that they inherited this expertise from their ancestors many years ago. At that time, Europe has just started to discover washing hands with plain water before performing surgery. Half of the women in Europe and the United States died during normal childbirth, and 100% of the women died when they tried to perform a surgical operation. Traditional expertise from Uganda began to be published in magazines in the 1880s and helped many countries in the world to enable women to give birth through surgery. This expertise was widespread among the Haya tribes living on the shores of Lake Victoria on the Tanganyika and Uganda sides. Even in the DRC, there were people with this skill that brought a great revolution to the reproductive health sector.